Hi, I'm Dr. Sylvia Skefich, chiropractor. Today we're going to be doing knee circles. So these knee circles can actually rebuild torn ligaments in your knees, and they can strengthen and create a supportive cuff of your own tissue around your own knees. So much in the way that somebody might want to wear a knee sleeve or a knee brace, we can actually rebuild a lot of our own soft tissue, our own functional scar tissue in there by doing specific exercises over time. That's how a lot of exercise therapy works. So the first time that I heard about this exercise was from my mentor. I had a few mentors I was lucky to have. One, his name is Tom Hendrickson, DC, chiropractor. And I worked in his offices for the first 2 years of my practice as I was getting started. And he told me the story of how he had torn his ACL in the knee, a very strong, almost pencil-like ligament inside the knee, the anterior cruciate ligament. And that he had rehabbed it because it wasn't completely torn off, but there was still some fiber left. And he had rehabbed it using this particular exercise. So I always remember that. I recommended it to my patients in my chiropractic clinic. But then, years later, I actually tore my ACL, and I decided to handle it non-surgically. By the way, this is not telling you to handle things non-surgically. You need to consult your own expert advice on that and make decisions that are the best for you. In my case, I decided to rehab it with exercise therapy, and it worked. And I had an MRI after 2 years later that showed that my ACL had completely repaired itself with scar tissue, and that's determinable on the MRI that it's made out of scar tissue now. So the way that you do these exercises is you basically have your knees and your feet together. Now, some people can't put their knees together because maybe they're overweight or they have some other functional issue. So in that case, you would put your knees as close together as you are able, and then put a bolster of some kind, like a therapy ball or a cushion, a firm cushion between your knees, as firm as you have in the house. So that would simulate having the stability of your knees against one another. But for most people, you put your knees and your feet together. By the way, before we get started, I gotta say, if there's any reason that you feel that you're unable to do this exercise, either for balance issues, lightheadedness, pain, or instability, you're uncertain, please consult your healthcare practitioner and make sure that you are safe to do this exercise before we begin. For most people, this is going to be a perfectly safe exercise. So all you do is you put your feet and your knees together. There's two positions that you might go into. Dr. Tom Hendrickson told me like this, and I often just do them standing up. You will feel different muscle groups if you're able to have a very good sense of your body. You'll feel slightly different muscle groups being used when you bend forward and put your hands on your thighs as upright, so you can do them both ways. And you just trace a circle with your knees, almost like a deep knee bend in a circle. I'm starting off clockwise. So you just begin to do knee bends with circles, starting in the clockwise position, clockwise direction. And how far down do you go is as far as you can go comfortably. Some people can literally only go this far, or even less, just whatever you can do. Some people can go really far, but then they hear a really uncomfortable snapping sound or strange sound. It's okay if you hear crunkly stuff, that will be fine. But if you hear a loud snap each time you go around, probably just goes just short of that sound, just short of any pain that you might feel. Now, the most important thing of this exercise is to keep your feet flat on the ground. Don't roll your feet around like little canoes from side to side. They are going to move some. You can't keep them from moving, but you want to minimize that movement. You also want to keep your knees braced together or braced onto your bolster. You don't want to see a shifting of the knees relative to another or forget to keep them together. Keeping your knees together is what keeps you safe in this exercise. because it keeps the menisces in place. The disc cartilage, you want them to stay in place and not be put in strange arcs of motion that might enable them to slip if you have a hypermobility problem or an instability problem. So once you've done 100 of those, you go the other way. Now, of course, if you're not able to do 100 or you're feeling fatigued, stop short of that. Work your way up to 100. But really, unless you're doing quite a bunch of these in a row, at least 50, I'd say, you're not going to create enough controlled strain, because controlled strain brings you little microfibers of your own collagen and fibrinogen tissue over time that lays down in those areas of strain and very light inflammation that we're creating. That's what exercise does at its best. It creates a controlled situation that allows your body to rebuild stronger in that region. Okay, so now let's take this exercise from the top. I brought in my timer because I happen to know from my own experience it takes about 3 minutes for me to do 100 circles. So I'm going to get started right now doing my circles. Again, there's 2 positional variations that you can try. And I would do them both. Do some days like this, some days like the other. And the other being just upright with either your hands on your hips or easily at your sides or wherever you want them. And I'm trying to keep my feet from rolling side to side. I don't want that to happen. They are going to move. You can't stop them from moving, but you want to keep that movement minimal without a lot of canoe rocking. You want to go down as low as you can without any pain and without any really unusual bad sounds. It's okay if you hear some grinding, some crackling. If that grinding or crackling gets worse over the days and weeks with this exercise, don't do the exercise. But it should get better over the days and weeks, or at least stay the same. It's this repeated motion. You're creating a controlled strain in your tissues that is in a functional motion. So it's not just any strain. Like you can go out and strain your knee in a twist. That's not the kind of strain you want. You want a strain that's going to be in a very controlled, natural range of motion that you might do as you're getting out of the car or as you're, turning to say hello to someone. This is a natural range of motion for your knees. And while you do the exercise, you're creating a stable situation by locking your knees together or locking it against a bolster if you need that. So it takes a while. We've only come up to nearly 2 minutes. We still have a minute left because we're creating this warming, circulating. It is actually going to create a little micro amount of inflammation in there. And that is a good thing on a very controlled micro level, because it's inflammation that creates a chemical call for fibers to come to the region. Your little fibers of collagen and fibrinogen, they come in and they're going to lay themselves down on a microscopic level to reproduce these lines of tension that we're creating. They're going to create a cuff around your knee that's nice and strong. They'll add on to ligaments that are already there, your collateral ligaments on the side and your cruciates that are on the inside like pencils. And over time, it's not going to happen in a day. Most exercise therapy takes about 2 weeks to begin to notice your change. So look for the beginning of change after 2 weeks. Some people get it much sooner, that's great, but don't give up. So now we've done 3 minutes, and we are going to go the other direction. So counterclockwise, you can choose either first, it doesn't matter, but do it 100 times each direction. Don't go back and forth, 2, 3 in one direction, and then 2, 3 the other direction. No, you want to create this warming, stirring, slightly, ever so slightly irritation to the tissues. That's going to create your tissue buildup in a nice functional way, in a way that you use your body naturally in the world. So I'm noticing that I'm actually getting a workout from this. I can feel my arches being used as I'm efforting my feet down into the floor, trying to keep my little log rolls from happening. I'm actually using my arch muscles. I'm getting a little cardio workout here. And also your stability muscles of your back are in play. It's great how the whole body is connected. And if you fatigue or you feel like, wow, you know, it's starting to hurt, I'm feeling something on my kneecap, you stop. A lot of these exercises you can just build up gradually over time to your tolerance. If you need to start with 3 in a row, 10 in a row, 25 in a row, just notice how you get better over time. It's really wonderful that exercise therapy is one of those things where when you do it regularly, you just build on what you have. You build on your flexibility or your strength or your ability to balance. Those are the 3 main things that I like to think about for exercise. So we're coming up on our 2-minute mark. And we have about a minute to go. I'm going to change back to my other position. And noticing this one relieves my back a little, but puts different strains down the length of my legs. And I just personally love to feel the nuances of what exercise does. And I can feel it actually creating a stretch down these side muscles, which get tight. Those muscles get tight when there's an arch problem. And I can feel it creating a nice stretch there. Still a little time to go. Don't push through it though if it's not working for you. All right, so a few more seconds. We're going to call it good for the day. So go forward and get stronger, better knees, and we'll see you on the next video.